The aim of the scoping review was to discover what is known about the relationships between rugby union and health and wellbeing, and identify relevant evidence gaps. Our search strategy was based on best practice frameworks and previously published relevant scoping reviews. Our protocol was published in a peer-reviewed journal as per best practice, and we found 6,658 studies, of which 198 met the inclusion criteria. Studies fell within 5 broad themes: rugby union and physical activity, rugby union physical health and function, rugby union mental health and function, rugby union and well-being, and then finally systematic reviews of rugby union injuries or acute health issues. Data suggests that all forms of rugby union, contact, non-contact such as tag or touch rugby, and wheelchair rugby can provide health-enhancing moderate to vigorous intensity physical activity and count as non-sedentary behaviour. As such, participants could benefit from a range of associated benefits, including a lower risk of developing type 2 diabetes, various forms of cancer, stroke and heart disease, as well as a lower risk of depression. Rugby union could play a role in encouraging the general population to meet international physical activity guidelines, something identified as a public health priority by the World Health Organization in the Global Action Plan on Physical Activity. The table on the right-hand side of the screen shows where rugby union contributes to some of the domains covered by these international physical activity guidelines. There is evidence to support a positive relationship between both non-contact and wheelchair rugby and physical health outcomes across a wide range of domains, including both cardiovascular and metabolic health and function. As such, these forms of the game could be actively advocated as health-promoting activities across the general population. The evidence base is generally mixed or less clear for contact forms of rugby union. Despite relatively fewer studies, the relationship between rugby union and both mental health and well-being is generally positive. However, professional players have a higher prevalence of symptoms of common mental disorders compared to the general population, though this is similar to elite athletes in other sports. We found that wheelchair rugby in particular has strong, wide-ranging mental health and well-being benefits, including improved quality of life, self-esteem, self-identity, functional independence, autonomy, and improvements in activities of daily living. Contact rugby union has high injury and concussion incidence rates relative to other sports across the spectrum of participation, and the highest injury and concussion incidence rates are seen at the professional level of the game.